Good afternoon, everyone, and thank you for attending today's webinar. I hope you and your families are safe and well during these uncertain times. My name is Tracy Schwartz, and I'm the Director for the Master of Professional Studies in Wealth Management program at Columbia University. Before we get started, I wanted to tell you a little about the program, which is launching in fall 2020. Columbia University is the first and only Ivy League institution to offer a wealth management master's degree and provide the educational requirements for CFP certification, which is considered to be the standard of excellence for financial planners. The 16-month program consists of asynchronous online instruction designed for the convenience of working professionals. The program itself is focused on problem-based learning, designed around real-life scenarios. The courses will be taught by leading scholar practitioners in the wealth management industry. We have an online information session coming up on Wednesday, June 10th at 12 p.m., and applications are due by Wednesday, July 15th. We will have our website address and contact information included at the end of the presentation. I am thrilled to welcome Dr. Meghaan Lurtz as a fall lecturer teaching the course Financial Psychology. Meghaan joins us today to discuss psychology and advice on navigating the financial anxiety of COVID-19. After her presentation, Meghaan will have some time for Q&A, which will be moderated by Olivia Austin in our admissions office. Please make sure to enter your questions in the Q&A box. Slides and a video recording of today's webinar will be available on our website in a few days. Thank you again, and it is my great pleasure to introduce Dr. Meghaan Lurtz. Good afternoon, Meghaan.
Hi, everybody. Thank you, Tracy, for that introduction. So as Tracy said, I'm Meghaan, and I'm going to be very honored to be very excited to be teaching a class on financial psychology this coming semester as part of the new wealth management program. And today we're going to talk a little bit about some of the things that I will actually cover in the course and amongst other things. So to get, before we get jumping in, I always like to kind of provide an overview about, where are we going and how are we going to get there. So we're going to start today by just talking about what uncertainty and feelings of financial insecurity do to us, sort of at an emotional level. We'll then talk about ways that we can deal with this sort of stress, anxiety, these feelings of scarcity, and discuss strategies for actually staying emotionally fit during this pandemic. We will close with ways that you can stay financially fit or potentially hopefully help you to stay financially fit during this pandemic, and review some of the highlights of the CARES Act legislation. So unfortunately, the situation that we are in brings together three things that as humans, we don't handle very well. In times of scarcity, stress, and anxiety, we become very bad decision makers. And I would say, a pandemic can probably bring out, the worst of these feelings of the stress, the anxiety, the scarcity in all of us. Scarcity, stress, anxiety, all of these things are relative to the person that you are. So simply because maybe you could compare yourself to another person and say, that's not what's going on in my life, so I shouldn't feel the way that I'm feeling. This is not a comparative or comparison thing. It's kind of just you against yourself. So if you're feeling these things, you're normal. If you're feeling these things, it's okay. Another thing, money is very emotional. Certainly we talk about the dollars and cents and what's in our bank account matters, but there's also this important part that money is very emotional, and we may see ourselves going through these freeze, fight, flight responses, especially given what's going on right now and the sort of situation that we face. And with sort of these three things going on, the scarcity, the stress, the anxiety, there's also this demand for a lot of change, whether it's staying at home or how do we go back, how do we change from what we've been doing for the past couple of months, which was a big enough change to move to now finding a new normal. And change, maybe even if we're looking to, forward to having this new normal, change in and of itself is a difficult thing to do. And even perhaps if you're excited about the change, that doesn't mean that it won't necessarily bring up stress and anxiety. So just to preface this presentation, there's a lot going on with our emotional bodies. There's a lot going on with our financial lives. That's just kind of all been mixed together, you know, in this sort of perfect storm, if you will. So to break this down a little bit, I think that it's helpful in thinking about eventually how we're going to combat, you know, these feelings of scarcity, stress, and anxiety. You know, what actually are these things? We use them oftentimes interchangeably, but in fact, they are not the same. So scarcity, this is again, any resource that you have where you simply don't have enough of that resource. So money, you know, perhaps we've lost a job or there's been cutbacks during this time of COVID and now we can't potentially, you know, afford the things we want to afford. There's time, you know, I am at home with my daughter a lot, which is not normal. And so, you know, if our children are at home all day and we're still trying to get stuff done, you know, there may be a scarcity of time right now. And then friendship, you know, we've been in isolation for nearly 2 months. You know, this isn't a good feeling either, even as a person who is relatively introverted. You know, these days there have been ones that I have really struggled with, just feeling connection with other people. So what happens, you know, when we feel scarcity, again, and scarcity can be very relative or subjective, we tunnel, or said another way, we're going to focus on that thing. And when we're so hyper-focused on that thing, that eats up our bandwidth. And a way to think about this is if I was sitting in front of you or sitting up right here on the screen, I just had math problems, even simple math problems that were popping up, you know, 4 + 4 is 8, 2 + 2 is 4. It would be very hard for you to focus on these math problems, but at the same time, pay attention to what I'm saying, let alone all the other things that may be going around, you know, if you're in your office or you're in your home or in your home office around you. And so this eating up of the bandwidth happens because our brains are focused on the tunneling. Your brain is busy doing this thing, trying to figure out this issue, focused on this thing that's scarce, and there's not enough left for you to actually think other thoughts, you know, whether it's, we call it tunneling, in that you don't necessarily think about all that's going on around it. And then the bandwidth, again, you can think of it as just really not being able to be as smart as you normally would want to do. So the fallout of this is that when we can't pay attention to other things that are going on around us, because our brains are focusing on this other thing that we don't have enough of, we miss stuff and we become less creative. We very often, perhaps unsurprisingly, become very focused on the now versus the future. And we might look for quick fixes, but quick fixes, you know, aren't always representative of our true values and actually may be detrimental, you know, to some of our long-term plans or long-term values. For example, in a financial struggle, it's not unheard of to make ends meet by perhaps taking out a payday loan. You know, payday loans are a quick fix, but in the long run, they are not a great option. So moreover, as you're normal, you know, if this is happening to you or you've noticed that, you know, there's just something that's kind of under your skin, you're constantly thinking about it. The issue though is that it's very problematic in that this whole bandwidth tunneling, it's a cycle to where the cycle itself, once you're in it, it's hard to break it. And when our brains are hardwired for that quick fix, we want to get rid of this thing that we've been focusing on. You know, this type of mentality was very helpful when we were running from lions. It is not necessarily as helpful now. And being that it is a cycle, it's very difficult to escape. So different from now financial stress, you know, I think it's important to point out, or, you know, perhaps a lot of people don't know, that stress is actually a two-step process. So an event's going to take place that perhaps I perceive as harmful, or there's a loss, or it's threatening, or it's challenging. And then there's this second step that happens almost immediately, where we ask ourselves, you know, can I handle this challenge? You know, yes, I'm afraid, but do I know what to do? And I point that out because stress won't arise for everyone. People have different resources, people see problems in different ways. And if you can bring about that feeling of self-efficacy, you can help to get rid of the stress. So stress is oftentimes, or it is, you know, more of an external event. People say, you know, I feel stressed, but they're feeling stressed because of this external event. And if the external event wasn't there and or you felt that you could handle it, the stress would not arise. Stress is a normal occurring thing. There's plenty of argument out there for even a little bit of stress is an okay thing. Stress is not necessarily an okay thing though over a long period of time. With stress, again, we go into this fight flight response, mostly the fight response, because we want to get rid of the stress and have it end. So not doing anything about if you are feeling stress, it's not necessarily the way to handle it. And we'll talk more about that. And also realize that stress can take many forms. Some people think of stress as feeling tired. Some people have a restlessness. Some people get angry. And even some people don't even feel any of those things, but then maybe they'll have like a stomach ache or they'll have a headache. Again, our emotional bodies, even though we may not recognize it in our more rational sense, our bodies will feel stress and carry stress within them, even if we think, our rational brains think something else. So just know that stress can occur. Stress is super normal, but stress is really about an external event and this understanding of, given this external event, can I fight back? Can I do something? Financial anxiety, again, oftentimes used interchangeably and certainly found to be comorbid, or people oftentimes have stress and anxiety at the same time. It is a different thing, and because it is a different thing, it has different aspects of it. So financial anxiety oftentimes is an unhealthy attitude. So it is internal that we are carrying anxiety versus the stress that is external. Anxiety tends to be more prevalent than stress. A lot of people will go through a stressful event and then feel the anxiety later, and the anxiety may stay, even though the stress itself has left. Anxiety also can look like avoidance. A lot of times, again, with stress, a lot of times we want to fight back right away. With anxiety, it can feel more like worry, agitation, kind of like we just kind of want to step away from that. Certainly it can lead to an all-out panic attack. So know that it can present in different ways, but it can also present in similar ways. So taking time to think about how you're feeling, what it is that perhaps is related to that feeling. Was it an external event that happened? Do you have control? Is it feeling like a loss of control versus just feeling overwhelmed? And or the thought process then that follows through that. Are we looking for quick fixes? That may happen more with the stress involved, or are we just trying to avoid it altogether? So now that we kind of have a separation of what these things are, just having a heightened awareness of them and the way that they impact us, this is an immense first step. We don't take a lot of time in our culture to just sit down, take a few deep breaths, do a self-check, a body check-in. How am I feeling? Where is my stress being held? What am I thinking about? What if I were to sit in silence for 10 minutes with myself, or even 5 minutes with myself? Where does my brain hop off to? It's very normal to do this, but not necessarily normal for us to take the time to figure out what it is that we're thinking and feeling. So hopefully, if you take nothing else from today, just that having an elevated sense of what you're feeling and taking time to feel those things will hopefully give you a better direction on where to go next. So if you are feeling like things are scarce, I cannot underscore enough how useful it is to talk to a friend or a professional during this time to get help and get out of that quick fix thinking, which is very, very difficult to do. We are very, very good quick fixers. And it can feel good to get to do a quick fix, but this is typically not the best idea that you could have come up with. So if you're in a scarcity rut, the best thing that you can do, the most simple thing that you can do is reach out. Another thing, if perhaps you're not ready to share about your situation, again, money is a very private thing. What we're going through emotionally through COVID, and now, what's going on with the different struggles in our community, then this maybe is not a time that you feel comfortable, bringing that information out. And so having a heightened sense of awareness that scarcity may be messing with you and your ability to think clearly, I would encourage you to make a pro and con list. It may sound very simple, but our brains are very simple. I'm just trying to get your body out of this fight, flight, or fight response. And so to stop us from doing that, honestly, very simple fixes work very well. And so sitting down and deliberately building out a pro and con list of, and as well as the near term, middle term, and long term impacts of the decision that you're weighing can help elevate yourself out of this quick fix mode. If it's more feeling like stress to you or stress involved with scarcity, it can have a very helpful and therapeutic, especially given what's going on in our country right now, to scream and let it out. You know, we get down on ourselves that we need to be in control and that we shouldn't be emotional and that, you know, we have to be rational all the time. But some of this stuff sucks. This is not fun. You know, this hurts. And we need time to let that out. And so take time, you know, give yourself 30 minutes, give yourself an hour. Let it happen on Thursday at 5 o'clock in the evening, knowing that maybe you could go have a beer or call your grandma or call your mom afterwards and cry, scream, let it out. Let go of those emotions that you're feeling and give yourself the right to do so. Next, after you get that over with, make a plan of attack, especially if you're going to call one of your friends. You know that going through scarcity and going through stress, same thing. You want to build an action plan, and you want that action plan to be well thought out. So, you know, when you are, you know, just thinking of different ways to handle it, I often think that the simple to-do lists, you know, that are very measurable and easy, even like starting the to-do list with make a to-do list. It feels really good to just mark something off. So that's one way to start. And then another thing to keep in mind is think about past wins. You know, hopefully nobody else on this phone call has ever been through a pandemic before, but I bet everybody on this phone call before has been through a time in which money felt tight, has been through a time in which things felt really uncertain. And go back to that time, take yourself back to that time and think about, okay, what did I do? You know, what strengths did I bring about? What personal abilities did I use to bring myself through to where I am today? You know, you have it within yourself to fix the things that you're going through. And so just taking the time to, again, be self-reflective, recall past wins, talk to family members about your strengths, you know, remember where your strengths are. But this can be a great way, again, to help you deal with stress. The biggest things for things not to do during stress, you know, don't ignore the issue. Stress, again, oftentimes brings out that fight response. So fight back, make the list, make the to-dos, and get things done. And this, don't necessarily go it alone. We all the time talk about the fight, the flight, and the flock. I'm going to talk about it a lot today, but there's also an additional F word, and it's flock, means to like come together. And this is another way in which we deal with stress. And so being alone during a stressful time is not the best way to deal with stress. It helps to spread it out. With dealing with financial anxiety, again, oftentimes stress and anxiety are comorbid, but they are their own things. And because there are their own things, when you're dealing with stress, it's going to look different than when you're dealing with anxiety. So if you're struggling with anxiety, you know, it can be hard to want to attack right away. As a person who struggles with anxiety, you know, this is me. So if you're feeling like, you know, I just kind of need some time to think about this, I'm not quite sure that I want to do anything about it yet, you know, that's 100% okay. You know, just recognizing that within yourself and saying, okay, what then do I need to do to get my body and my brain into a relaxation and learning mode so that things feel less scary when I do try to take some action? And you can do that through yoga, meditating, painting, anything calming, having a cup of tea, listening to your favorite type of music, you know, whatever that may be, just relaxing and learning, you know, taking time to ask questions. You know, there's a reason why we call it learning and not knowing. We don't know things in times of uncertainty, but you can certainly learn things in times of uncertainty. And it's okay to explore that even when you're feeling anxiety. No one's making you do anything. You're just in collection mode. Another thing, you know, similar to all the other advice I've given, ask for help. You know, similar to stress, isolation is not your friend, but you may want to let that friend or family member know that you're just looking to connect, you're looking to brainstorm, perhaps even just looking to express that you're feeling nervous or just what's stressing you out. And that we're not really in the solution mode yet. The goal is just to feel connected, to feel safe, not necessarily ready to take action. And then last but not least, I can't underscore this, recognize growth in yourself and recognize growth in others. If you have friends and family that are going through this, take the time to make a compliment to them. Working through anxiety is like walking through molasses. It's tough, it's sticky, it takes time. Any progress is progress. And you want to recognize that in yourself in order to develop the momentum to keep going, to get through the anxiety. So other ways, to stay mentally healthy during this time, put your mask on before helping others. I can't stress enough that taking care of yourself, is not a selfish thing to do. It's a very important thing to do, especially given at the time that we're in. And so other things that you can do, turn off the news. A lot of people don't realize this. I talk to people every day, talking to people as part of my job. And I oftentimes I talk to a lot of financial advisors actually, and they usually just tell me, I'm just listening to my clients, I'm just listening to my friends, or I'm just listening to the news. But our bodies, our hearts, our minds, again, we are not meant to carry stress all day, every day. And it's simply not a question of, if you're an empathetic person, even if you're not a super empathetic person, listening to the stress and pain of others and what's going on in the world, I'm not saying be blinded by it, or, be blind to it, but to sit down and just constantly watch the news. There was a study done on after 9/11 that people in outside of New York, they had just watched the Twin Towers get hit over and over and over again on the news. And because of that, they actually developed symptoms of PTSD. They weren't even in New York, they were far away. And just watching the news over and over and over again, it takes its toll. Mental health practitioners are even trained to do this, or trained to learn about this. In mental health world, it's called vicarious traumatization or compassion fatigue. I don't think that probably most of us on this call, although maybe, are mental health practitioners. So likely you have never received training for this, may not even knew that this was possible to have happened, but it can. So just be sure that you're taking care of yourself and distancing yourself. Decide on a stop and start time, or decide, I'm going to watch the news this morning and then I'm going to turn it off, and that's going to be the only time today I'm going to watch it. If, this is happening, chances are good the way that it's impacting you is you're not going to be able to be as objective because your emotional body is taking over. You're going to struggle to be creative. It can bring you into that stress mindset. It can bring you into the anxiety mindset. Recognizing stress and anxiety in yourself, are you currently overly worried or, unable to relax? Are you dreading and at the same time needing some social interaction right now? Are you creating busy work for yourself, whether at home or if you're actually working? Are you skipping lunch, or like me, eating lunch constantly in front of your computer and therefore working maybe more hours than maybe you would have ever worked before? If you've answered yes, to any of those questions, one, you're normal, you're doing things that we all do during this time, but these are likely attempts, probably very rational attempts, to exert control in an effort to fight off or handle our own anxiety and stress. So if you're doing these things and you're just thinking, I'm working, I'm gonna make it through it, you're just trying to handle your stress, which is okay that you're doing that, but realize that it's stress and realize that there are healthier ways to deal with stress than to sit in front of your computer, eat lunch there, and don't leave it for 12 hours, plus with the news on in the background. There are better ways to do this. Self-care isn't selfish, so again, a few other things. Triads, again, this comes from the world of therapy, are a good natural way to handle anxiety and or stress. So think about, when you're upset, who do you oftentimes want to talk to? Your best friend, your mom, your dad, your grandmother. Give this person a call. It's a very natural way to spread out the difficulty that you're having. Discuss positive things, not just the negative things that are going on in your life. Again, it's a very simple thing my mom has been telling me, for years, but hey, Oprah does it too. Count your blessings. Like, it does make a difference to choose to have a positive mindset. It may sound very frivolous and flippant in the beginning, but continuing that practice, maybe instead of, again, like in place of the news at night, just jot down 3 things that happened good that day. Another thing that I would encourage you to do is to protect your time. Again, scarcity can be financial, scarcity can be time, scarcity can be our relationships. And so if you're not protecting your time, this can cause, just an inability to think well, which is not what we want during this time. So take a walk, practice social distancing, wear your masks, eat lunch, but not in front of your computer. Have a start and stop time. I know that many of us have transitioned to a virtual office space. I have been a long time virtual worker, and I can tell you that the most important thing you can do for yourself is choose a stop and a start time. Your computer is always going to be there. The questions are always going to be there. You can always go to the email tomorrow morning, but to go in at 8 and stop at 5, and that's it. Don't, then go sit and actually Netflix and chill. Don't just keep going back into your computer. If you can have a designated work area, do so. Get that stuff away from your sofa. Definitely don't take that to your bedroom. Be done. Don't answer emails at night, or even read them. Just be finished. And then if you're going to have meetings, talking heads are not necessarily always the most fun thing to stare at all day long. So if you do have a lot of meetings, try to have space in between your meetings. And even if you just walk around your house, or walk to the kitchen and walk back, or do some jumping jacks, just anything to get your blood moving and to space out your day, so that you don't feel inundated by the meetings is important. So last but not least, before we hop into the legislation, I can't stress enough, just given all that's going on, between Black Lives Matter, between Me Too movements, between what's going on with the pandemic, the uncertainty of, how we're going to go back to work in a normal place, the jobs that have been lost. We've had unprecedented numbers of people apply for unemployment. There's a lot going on right now. So call a friend, call a family member. If you need help today, be sure to reach out. If you do not, you have more time, research the financial or psychology today. You literally just go to that website, Financial Psychology Today. You can put in your zip code and it will bring up mental health practitioners that you can reach out to. Another great place is the Financial Therapy Association. Again, given that a lot of what we're going through in the pandemic is this combination of money and psychology, talk to somebody whose expertise is in that area. When it comes to mental health practitioners, I always tell people that it's like dating. Call them up. They all have specialties. They all have different things that they like. Talk to them. And maybe if you have a meeting with one of them and you're like, this didn't exactly feel right, talk to another one. You really want to work with someone that you can have a conversation with and that makes you feel good, makes you feel comfortable. If you don't feel those things, find someone else. It's just like dating. And then last but not least, know that there are lots of different types of therapy. I've had people say to me, I don't, laying on a couch, just talking to somebody about my childhood is, just really not for me. There's narrative therapy, there's solution-focused therapy, which are totally different experiences than just the traditional, Freudian couch sitting. And so I would encourage you to Google those things or just Google different forms of therapy and see what comes up. You may find something that really works well for you. So switching gears to talk about actual legislation and how maybe we can improve our pocketbooks during this time. The goal of the CARES Act was really to keep people working. And so majority of the benefits really focus on this aspect. So we're going to cover each of these and talk about them a little bit. So the retention credit and the deferral of payroll taxes. The employee retention credit, if your company, if you're a small business owner, has more than a 50% quarterly drop or greater when compared to 2019, at the same time, you can apply for employee retention credit. And what that is that you can get up to 50% of wages paid to each employee up to $10,000. So said another way, all of your employees could qualify for up to $5,000 per employee. There's also a deferral of payroll taxes. Assuming your company does not have debt forgiven by the CARES Act, employers are eligible to defer payroll taxes from the enactment to the end of 2021 or 2022, or really essentially both, doing 50% by December 31st of 2021 and then 50% by December 31st of 2022. I left on here the economic injury disaster loans. These are no longer available, but it did provide businesses right away with $10,000. I'll get to that. So unemployment, the CARES Act really has three pieces of legislation within it that are related to unemployment specifically. So there's the pandemic unemployment compensation, which provided an additional $600 per week in compensation through July 31st of 2020. So I realize that time is almost up. I'm sure many of you have heard in the news lately that, our government again is thinking about just more ways that they're going to pump money into the economy and different things like that. So, it's possible that something related to the unemployment compensation would also get increased or moved, but as of right now, this additional $600, this benefit ends on July 31st. The pandemic emergency unemployment compensation, this piece of it is what added the additional 13 weeks of unemployment after normal state benefits have been traditionally exhausted. So all but 8 states, and unfortunately I did not put on here which 8 states, but most states offer 26 weeks. So within most states, you can get up to 39 weeks of unemployment during this time. So again, even though this is a federally funded program, you must actually apply at the state level to receive your unemployment. I know that there's been some confusion, and I also know that some states, have this process kind of nailed down really simple, and then other states it's been kind of a mess. I can only apologize on behalf of our government for that. I'm very sorry. But so depending on your state, this may be more or less easy, but do know that these benefits exist. The 1 week waiting period was also removed under this piece. And then last but not least, the pandemic unemployment assistance, unprecedented, self-employed persons. So independent contractors, freelancers, part-time workers, and workers who have not worked long enough to receive state unemployment benefits can apply for unemployment benefits. This never before has that been possible. And this program where self-employed persons is going to run through the end of the year, absent any extensions past that. So really, you can't receive unemployment if you're receiving paid sick or paid leave or sick leave, or if you're teleworking because you're working. But really, if you are impacted, by the pandemic, this benefit is here for you, and it is pretty broad, and that is on purpose. So it may not fix everything, but a little bit of alleviation may go a long way in just easing some stress. The Paycheck Protection Program, this was kind of like the sexiest part of the legislation, if you will. Again, it really focused on small business owners and this idea of free money. And so if you are a business owner, or you work with business owners, or even the business that you work for, if they are struggling and you're like, hey, I watched this webinar, this is the stuff that really matters. So if that business that you work for has 500 or fewer employees and is experiencing issues thanks to COVID, you can actually apply for free money. So in practice, if the business has been in practice for at least a year, you can apply for 2.5 times the average monthly payroll costs prior to the loan. For less than that time, 2.5 times the average monthly payroll costs for January and February. The max amount that is eligible for forgiveness, it's equal to what is spent in that first 8 weeks period. What's included, in thinking about okay, you said payroll costs. What are payroll costs? Salary, wages, and commissions, payment for vacation, parental, family, medical, or sick leave, healthcare benefits, state and local taxes assessed on compensation. And what can the money be used for? Again, this is all about businesses. So, payroll, mortgage interest, rent, utilities, interest on other loans. And then what is the rate? What do you get if you do apply for this? The rate is 1%. And the way to get it, is to visit your small business association. It is first come, first serve. We originally started with 349 billion. We ran out. And so a law was passed again on April 21st of 2020, approving another 310 billion. There isn't a lot left of this. I should have looked up the number this morning, but I did not. But it is there. It still exists. If this is something that you're going through, and just being able to keep your doors open, being able to keep your employees employed, or even again, if the business that you're working for, that they're struggling, but perhaps you're not the business owner, this is the program that's been created to keep the economy moving forward. So find out about it. Again, it's relatively painless to apply. However, I will say that there's been a lot of struggle with, okay, now my application's in this like black hole, what's next? So there hasn't been a lot of great communication there, but do know that, the government, much like us, we're not prepared, for the fact that COVID hit, so I try to be very appreciative and upbeat about the fact that all these programs are available, even though the programs processes themselves are, a little clunky. So what does the CARES Act offer for individuals? We just talked a lot about all the different things that you can do for your business or for the business that you work for. There are, there's the recovery rebate, student loans, access to retirement funds, and some time with your family, which we're going to talk about. So these recovery rebates, hopefully everybody on this phone call has received theirs. I will say if you have not received yours, the IRS website has a tool called Get My Payment. Probably it has something to do with like the address, or maybe you've changed bank accounts, or something to that effect, but there are ways to track down this money. The way that it works, or the way that it has worked, is it's $1,200 for individual or head of household. So think $2,400 for a married couple filing jointly, and then an additional $500 for each dependent child under age 17. So a married couple with 2 kids, they're looking at receiving $3,400. There are phase outs based on this. The phase out works for every $100 the taxpayer's income exceeds their credit. Their potential recovery rebate is reduced by $5. So if you are at $99,000 as a single or married filing single, you're not going to receive anything by the time the threshold, the AGI threshold. I should have put those in there and I forgot. But by the time you get to that level, there's nothing left of reducing the income. So if you are at these incomes, you would not have received anything. So if you are, hopefully you're doing very well and not worried about receiving this if your incomes are what we see here. But if your incomes are less than this, certainly your rebate could have been reduced, but it wouldn't have been reduced to 0. So for the student loans, I know that for today, there's a number of students that are actually on this call. So this is probably a big benefit or important benefit to you. And that is that right now for federal loans through September 30th of this year, you don't even have to do anything. Relief measures were put in place or auto implemented for all borrowers as of April 10th. So if perhaps you want to continue to pay, you can, but it's basically a free interest loan right now, so if you could use that $200, $400, $1,000 right now, do that, use that for yourself. If you don't have a federal loan, can you still get help? There are a number of individual lenders, responding to the situation that we're in. I would encourage you to call and find out. If you're in a loan forgiveness program, how does this apply to you? Assuming that you've been in the program since March 13th of 2020, you can use these 6 months as credits and not have to pay. So if you are in a loan forgiveness program, do not pay during these 6 months. It does not hurt you to not pay, and it doesn't make sense for you to pay if you're going to get the credit anyway. I have an income-driven plan, an IDR plan. You know, what can I do? If you've lost a ton of income lately, which many people have, you know, do consider recertifying your income, but wait to do so probably until August in order to take advantage of this free time. You know, you can recertify at the end of August. Things probably won't be quite what they were, maybe what they were in like February, you know, so wait and recertify after the free 6 months are over. So access to retirement accounts. You can take a distribution up to $100,000 from your IRA or employee sponsored retirement plan, or a combination of the two. Distributions are exempt currently from the 10% early withdrawal penalty. So even if you're not 59 and a half, if you need this money, it's okay. You're not going to get that penalty. Not subject to a mandatory withholding period, which is nice. You can repay the amounts back over 3 years. So again, if you need $10,000 right now and you want to put that back because you've worked hard to save that money in your 401k, you've got 3 years to do so. You know, do what you need to do to survive. But at the same time, you know, thinking of what we learned about earlier about scarcity and how it makes us do knee-jerk things, you know, realize that they've built into this plan a way for you to also, you know, fix this long-term. You can also spread the income over, you know, so maybe you don't want to take out $10,000 in one lump sum. Maybe you want to take it out over 3 years. You can also take out loans from your retirement account. So normally you can only borrow up to $50,000. You can now borrow up to $100,000. 100% of the vested balance can be used, and you can delay payments on that loan, paying it back for up to a year. I will mention here that required minimum distributions are also waived in 2020. And if you took a distribution like early, you know, distributions are not required until April. So maybe you were on the ball and you're, you know, you like to take them in February, fine. And then COVID hit and you're like, oh crap. And then the government said, oh, you don't even have to take one. And then you're like, great, thanks for telling me. It's okay. You can put it back. Finally, you know, getting into like what I meant by time with family, you know, this is a hard time. And you know, again, being home with our families, you know, someone in our family gets COVID, being home with our children, maybe just wishing that we could isolate them in their own rooms, sans COVID, you know, there's just a lot going on. So there is the Families First Coronavirus Response Act. And as part of that, there is the Emergency Family and Medical Leave Expansion Act. And the Family and Medical Leave Act, this existed prior to COVID. It continues to exist. Really, you've, as an employee, you have all of your former rights, but the rights have now been expanded. So if your employer has less than 500 employees and you've been employed for at least 30 days, you're able, and at this point in time, you're able to or not able to work because you need to care for a child due to school or daycare closures. You may take up to 12 weeks. The first 10 days are unpaid, but employees may take existing paid leave during that time or use emergency paid sick leave to bridge that 10 days. After the 10 unpaid days, the employee may be paid 2/3 of his or her regular salary, or if you're hourly, up to a max of $200 per day or $10,000 in total. When an employee returns from leave, they must generally be returned to their former position or similar position. So again, I mean, as a mother going through this, as a relatively new mom, my daughter is 1, this has been really hard. This has not been fun, and there is certainly always nervousness, you know, around these sort of things. And so if you're a parent and you're going through this, you know that this exists for you, know that it is your right to ask for these things. And it is not necessarily going to be or should not legally be detrimental, and that you can return to your former position, you know, and take care of your family. We need to take care of your family. Continued the Emergency Paid Sick Leave Act. Any paid leave, you know, again, similar to what we just went over, that these rights are really, they were in place before COVID. Now, really, they've just been expanded. So if the employee is subject to quarantine or isolation, the employee has been advised by a healthcare provider to self-quarantine. If the employee is experiencing symptoms of COVID-19, if the employee is caring for a person who is sick or quarantined, or the employee is caring for children because of school or daycare. Full-time employees are entitled to 80 hours of paid leave. Part-time are entitled to paid for the number of days, hours a day they work, on average for that 2-week period before the leave. Independent contractors and self-employed are eligible for a refundable tax credit. Employees can still take whatever paid leave or was available to them before the law was passed. Employers cannot retroactively change their leave policies in response to this new law. That is illegal. And then employment laws are complex. You know, this is unprecedented times. You know, things are changing. If you have questions, ask. You know, ask your employees or employer, you know, about these things that are available to you. And I'm almost done. We're going to open it up for questions here in a second. Last but not least, you know, just want to encourage you, you know, that telehealth, you know, being isolated, I know that some lockdowns are more strict than others, but don't let isolation stop you. You know, the American Counseling Association, AAMFT, many states have extended their telehealth services to therapy services. Telehealth is covered under Medicaid, which again, by state can include therapy. And then if you are an individual that has a high deductible plan, you know, individuals can use their health savings plan money to pay for telehealth services. Like, given what's going on right now, you know, our government wants to make mental health services available to anybody that need them. So just be aware that these exist and that this shouldn't stop you from being able to get help. And last but not least, you know, again, I've talked a lot about the mental health side, but financial planners are amazing people. Financial professionals are definitely someone, you know, that is worthwhile to talk to. And just knowing that there's a lot of Columbia persons on this call, and particularly if you are a Columbia student, you can reach out to Student Life, you know, regarding financial resources. And they have confirmed that they have resources mostly related to budgeting and paying for tuition, but they have another resource which is called Columbia Grad, which is a web-based financial literacy platform. I would encourage you to go there, ask questions, you know, get feedback. If you have more questions about student loans, you know, don't sit in the dark. You know, that's probably one of those things that, again, if you take nothing else away from today's conversation, is that, you know, you have resources. These resources are available to you, be it your mom, your financial planner, or your friend, to help you think through some of these ideas. And that much of what is available, even in the legislation, you know, is trying to support that. So don't necessarily think that you have to do it all on your own, and or that if you just ignore it, it'll go away. So with that, I will end. That's all I have. I hope you enjoyed the presentation. I know that we are going to open it up for questions, but I will say, if I don't get to your question, and or again, I fully understand that what people are going through right now is both financially and psychologically difficult, and there may be questions that are very personal that you do not wish to share. You can email at the wealth management, and they will make sure that those emails get to me, and I will personally reach back out to you.
Thanks so much for such a wonderful presentation, Megan. My name is Olivia, and I will be going over the Q&A today. So if you haven't done so already, please type your questions into the Q&A box. So Megan, what is financial therapy or financial psychology?
So financial therapy and financial psychology, so financial psychology and financial therapy both kind of fall under this umbrella of behavioral economics. You know, so what are people doing when they start thinking about their money? What are some of the goofy things that we do? You know, again, thinking of, we like to think about the now. You know, everybody likes to buy the chocolate right now. They don't necessarily want to put it off to the future. So knowing these goofy quirks about our brains, there are now financial psychology and financial therapy that work with the individual, not just to highlight, you know, the goofy things that our brains do, but actually provide structure that helps people to get past those things. So whether in financial therapy, working with under a solution-focused model, maybe you're working with someone who's uncovered that they want to save more. And so then we work with that person to perhaps think of past wins when they were able to save, or just past abilities, when they were able to kind of overcome something that was difficult for them, and help them to put that into this, into a wealth perspective in order to move themselves forward. So it's behaviorally informed, it's psychologically informed, it's therapeutically informed, ways to work with individuals when it comes to their money, more so than just being like, oh, well, I see here, you are acting out of a heuristics bias, that like that's helpful. It's good to know. But financial therapy and financial psychology actually work with the individual to move them past just kind of understanding what those quirks are.
Thank you, Meghan. Do you know if the 0% interest applies to newly borrowed federal student loans during the applicable period?
I believe I want to say that that there's some March date. It's not popping into my mind. Whoever has that question, please email me and I will respond back to you, because I am not exactly, and I definitely want to give you the right answer. Part of me wants to say it was sweeping, and so if you had any federal loans taken out at the time, it shouldn't matter if you took them out the day before or not. But being that I am not quite sure, and that I feel like there's a March date that I should be remembering now, I don't want to give you the wrong answer. But if you give me just a little bit of time, I could look that up for you, and I definitely want to look that up for you.
Thanks, Meghan. We have another question here. As financial advisors, we are not qualified in mental health. How can we find people to work with our clients? And then just some background information. Many clients have difficult relationship with money. Some can't seem to keep any money because there was some past trauma about it. So what would you say to this, Meghan?
Yeah, money is a goofy thing. It does. We carry a lot of emotion. Money means different things to us and represents different things to us in our life. And certainly when someone has had past trauma, it can come out in their financial behaviors. And so if you're a financial planner, and obviously if this person is opened up to you, I mean, you're aware that there's trauma in their background, for one, whoever put out that question, thank you for the great work that you're doing. You are obviously a empathetic financial advisor, and your client trusts you a lot, which is an incredibly important and powerful thing. So in that position, I would encourage you to, take your time to go to either the Psychology Today website or the Financial Therapy Association website and read through, some of the maybe mental health practitioners that are in your area and or financial therapists that are in your area. Learn a little bit about them, call a couple of them. And once you've talked to them, I would encourage you, again, you would be potentially telling your client or letting your client know, hey, I want to try something, here's the name and number of a therapist. That's going to go over a lot smoother. If you know this therapist, you've had coffee with this therapist, you've even been to this therapist's office, maybe even done a little bit of therapy work for yourself, so that when you go to make that recommendation, again, you can let the person know, like, this was the office, this was my experience, it was really great. I also would encourage you that when you do make that recommendation, that you make it normal. This is a thing, like, given the pandemic, you can blame everything on the pandemic. Given the pandemic, Sue, you've been going through a lot. I've been going through a lot. We've all been going through a lot. There's just a lot of trauma. And because there's been so much trauma with just what's going on with the pandemic, as a part of our office and what we're doing, we're connecting all of our clients to a financial therapist. We've actually, the office has met with 3 of them. Here are the 3 names. Let me tell you about the differences between each one of them, so that you're letting Sue know this is normal. We're not telling Sue this because she's crazy. We're not telling Sue this because she's a pain in the butt. We're telling Sue this because we're telling everybody this, because this is a tough time. So I would just encourage you as the financial planner, to search out those relationships. Financial planners, as much as you guys are interested in mental health workers or mental health professionals, there's a lot of mental health professionals that are also very interested in finance. So finding someone that wants to talk, about money and is comfortable talking with money, or at least wants to learn about money, you can come together in your practice, and or just know that you can call that person and refer someone if you need to.
Thank you, Megan. We also received a few questions regarding the slides. I want to let you all know that the slides will be made available and they will be posted on our website, which you can see up here on the screen now. We have a question from Crystal. How do we keep up morale as a branch when we are all working remotely? It's starting to get very frustrating.
Yes, it is. Okay, so as a person, so I'm in addition to, so I live in Spain. I don't even live in the United States, which is why we're having this at noon, because it's in the evening for me. And then I've actually been a remote worker for the past almost 2 years now. So even though I experience it differently, I understand, my initial change to becoming, a virtual worker was tough. And part of what kept me sane, it's going to sound like I'm quoting I don't know if anybody reads the food blog in the New York Times Cooking, but today Sam Sifton, he wrote about how food and cooking for ourselves, can be such a nice gift. And so actually during my time when I was learning how to work remotely, one thing that I decided to do, because again, I would keep going back into my office and work and keep going back into my office and work and messing with this. So I just decided, at 5 o'clock, I'm going to be done every day and I'm going to go into the kitchen and I'm going to cook something. And so I learned how to cook when I first started to work remotely in order to distract myself, but also create a gift for myself. So whether you do something like that, to denote the end of your day, if you are able to space your meetings out so that you're not having meetings, back to back to back, you're also in your house, so if you can, do yoga or something like that to just kind of break up your day, no one's gonna, maybe your neighbor will see you, but your coworkers aren't gonna see you doing a downward dog in your living room. So I would encourage you to just kind of get up and move around, take a walk, just get outside of your house. And then I know that we spend a lot of time in front of our computer screens, so I have a difficult time advocating for more time in front of your computer screen. However, my work with Kidsist.com, for example, or Nerd's Eye View, some people call it that. We are a completely virtual team, and we play virtual games together. So a number of us do the New York Times crossword, so we have kind of like duels about the crossword. We also use what's called House Party, which is just like everybody logs into House Party on your phone or whatever, and you can play games. And so you're with people, you're having a good time, you're playing categories or something like this, but you're not necessarily just sitting there working, going back in and working more. You need to let go. So Netflix and chill is very important.
Thank you, Megan. So we have time for one more question and then we will need to wrap up. So the last question that I'm going to be able to get to today is, what are the needs of ultra net worth clients with respect to financial therapy? How do they differ from regular wealth management clients?
Sure. So, in my experience, high net worth clients have just as many, strange financial beliefs as the rest of us. And oftentimes they just have sort of more money to play out, those strange financial beliefs that they have. And it can look different in different ways. If you're a high net worth individual, maybe you have more of a tendency to be an enabler, for people that don't have as much money, which can be a problem because it's going to bring down your net worth. Maybe it's within a family business and there can be lots of different dynamics, with psychology and having your family. There can be many benefits to having a family-owned business, but also there can be a lot of problems with being a family-owned business. there's actually a theory, and now the name is escaping me, but it has to do with the Godfather and the brother that gets killed, you know, because he was kind of the poor performer. This is actually very common in family-owned businesses. And so certainly just, you know, as an individual, you know, we grow up in society that tells us stuff about money. We grow up in a family that tells us stuff about money. And the things that we learn about money are, you know, are not always right, or they're certainly not always right all the time. And so, you know, I wouldn't say that the problems, if you will, or the issues, you know, that a high net worth family has in comparison to just the average, you know, financial planning client are that dramatically different. You know, money is universally a very, very difficult thing. And we spend money in strange ways. We do strange things with our money. We believe strange things with our money. And when you've never had the time to, you know, slow down and think about those things, and maybe perhaps people with lots of money don't oftentimes have to slow down to think about the money part because there's always money there. So maybe that would be a difference, but it is something that we universally struggle with. So I don't think I answered that question perfectly. Basically, we're all crazy. So financial therapy, financial psychology is very important, and you should join me, you know, at my class, and we will learn about this together.
Thank you so much, Meghan. That was a really wonderful presentation, very informative. I want to thank everyone so much for joining us today for this session. I'm sorry if we were unable to get to your questions, but I do encourage you to email your questions to the email listed below so that we are able to get back to you. And also, the presentation, along with the recording of the session, will be up on the website within a few days. The website is listed here on the screen. So thank you all so much again. Please continue to stay safe and healthy and have a wonderful day. Thank you.